Hi, my name is Katie McKee, and I'm going to be doing the skill of a CVC change. So the first thing we're going to be doing, before we do it, we're going to basically be looking at our orders. We want to make sure that we have the order for the dressing change, and we want to make sure that we've checked our facility policy to make sure the date and time of how long a change can be on for. So after we do that, we want to go into our room, obviously introduce ourselves to our patient. This is our mock patient here. We want to check his wristband, make sure we have our right patient, date and birthday, of course. Then we want to check our site and check and seat around the dressing change. Look at the skin integrity around it, make sure that there's no redness, swelling that we can see first offhand, any sort of drainage already going on there. So after that, we also want to get our supplies ready. So we have all our sterile supplies here, and we'll open those up here. So we have our gloves. We have our chloroprep here. And our 2x2. Okay, so once we get those all set out, we then want to go to our patient where our dressing is. And we're not yet going to put our gloves on, but we want to take off the dressing that was on there previously. And we'll just do that because it doesn't come off very well if we have gloves on. So basically that tag nerve, we want to take it and pull it inwards towards the incision site. All of that tag has been pulled up. We will then put on our clean gloves, pull the dressing off. When we pull that off, we want to take a look at the actual dressing. We want to make sure we look at the type, see if there's any sort of dressing or any sort of drainage on it, any sort of type of drainage is on it, the color of the drainage, the odor if there's any, and the color, of course, if there's any sort of that on there. So, we then want to actually look around the incision site. We want to look and see the skin integrity, see if there's any sort of redness, any sort of swelling going on at all, any sort of pain the patient's having, any sort of other drainage you see going on there. There's also 2 sutures in place too by the CVC, the lumen up front. We want to look at those, make sure that's all intact too as well. So, after we have that all done and dressing has been taken off, we will remove our clean gloves and put on our sterile gloves. So we are just doing clean here. Put those on. We step back from our sterile field when we put those on. One time. And then clean. And step back from our sterile field and we put those on. And they are on. Remove the paper. Next we're going to get our chloroprep ready. We're just going to back away so we don't spray anybody when we activate that. Activations on, come back, making sure that we don't turn away from our patient or our sterile fields. So when we clean our incision site, we want to do it in a box formation. So we will start either side, left or right. You go up or down, you go on the bottom, across, and the other side. Just make sure you get that good and clean with that chloroprep, with the friction there. Only other place is the CVC, the lumen area there, to get underneath that. So you do that by taking one of your fingers and making it dirty, usually the pinky there, and lifting those up and getting good underneath that. And placing it back down there. So now that that's all done, you'll let it dry just a minute there. Still sterile here. We'll take our 2x2 and put it over top of our incision site there. And next we will take our Tagaderm, take it off. We want to make sure that there's like that little crease there with our Tagader. We want to make sure we have that portion up by the CVC, the lumens there. And we'll just put that on over top of our 2x2, making sure it's all good on there. And moving it. Alright, we are all good. Only other thing we want to do here with our dressing site, when we peel it off, make sure it's on good and tight, we want to make sure that we label it with our name and the date at which we did it, and then make sure that we label our dressing change with that. And our dressing change is now complete. Only thing else we want to do is make sure we document what we did, make sure we want to document any sort of drainage that we've seen on there, of course, how the patient handled the procedure too, and anything other findings that we found. So that is the ending of my skill. Thank you.